fetal heart monitoring. I want to show everybody our new fetal heart monitor. Just came in. And as I'm doing your competency checkoffs, and as I'm going to put this patient on here, I'll show you all the new and improved technology that we have gotten with this machine. Our beautiful model is 37 weeks and 3 days. 3 days, so we're getting closer to delivery. Okay, for competency purposes, you're going to get your supplies before you come in here. Wash your hands. If the patient's membranes have been ruptured or a bloody show or any other soiling, you would want to put gloves on. For this, I'm not going to put gloves on, and for your competency checkoffs, you do not have to have gloves on. When you're with an actual patient, you can use your own judgment on that. I do not use gloves when I'm working with OB patients unless, again, they have ruptured membranes, bloody show, or there's a reason that I need gloves. But just for touching the abdomen and do Leopold maneuvers and putting the monitor on, you do not need gloves. Okay, so this is our new monitor. This green button, if you want to zoom in, is how we're going to turn it on. And it takes a minute to boot. It does come with a battery, and the date and time will be saved in here, so it will be recorded as it starts to print. There it goes. Okay, we just had this baby going. I like that. Comes on. Okay, and I'm going to hit print to start. And what it's going to do is it's going to print the date and the time. But what I like to do as an old school nurse, which is a good practice, I like to just write the date. And then I like to check the time, because sometimes even the internal memory might get it wrong. And that way, if ruptured membranes or something that you want to record the exact time of, you would want it to be exactly correct. So I'm going to put 16:25. Okay, and as you can see right here, it is coming out printed. Okay, so with this new machine, we have the capabilities of monitoring 1 fetus or 2, both external monitors. So I'm going to grab my supplies. We have them all right here in the lower part of our new cart. We have the monitor. So since our patient has 1 baby, I'm going to get the ultrasound transducer. Okay, you hook it here, and it snaps in. You can just find it. There it goes. And this, of course, is the only one that gets the gel. And then you want to get your Toco. And this is has a green plug and it's blue, and this is the one that does your contractions. Now, with this new monitor, I wanted to show you have 2 options. You can use, our model already has her fetal band on, which I love these. You don't have, they're actually easier for the patient. Or you can use belts. I'm going to show you both. These belts are good for twin gestations, and also if the patient is, as the baby labor is progressing and the baby moves down, these are easy to move down with the ultrasound as the baby descends down the birth canal. Okay, so some of you guys have never seen these, so I'm going to do them really quick. My model's going to kill me. And I'm only going to do one just to show you, guys how to put this on. And then we'll go over your competency checkoffs. I just wanted you to see the new machine and also see how to hook this up and turn it on. So transducer, this is the Toco, and this will show you your contractions. You're going to put this at the fundus at the top of the uterus. How you do that is you want to feel top of the uterus. This does not get any gel. This is the blue and it has the green plug, and it will tell you your contraction. So you put that on here with the belt, with the band, or you can actually, I was going to show you how to use this. And then I like it kind of tighter, come across, get it right about here, and then you want to zero it after you get it on. Now this is just to show you how to use the belt. I'm not going to use the belt for this video, for our checkoffs, but this is just in case there's a patient that doesn't want the band on, or we're out of bands, or the patient is too big for a fetal band. Sometimes we do have to use these belts. They're in here in the bottom and they're ready to go. They do need to be laundered between patients. Okay, we have 1 baby. We're going to go ahead and set our Toco up. And this is all nice and color coordinated. So green is for contractions, and it's your TOCO. And blue is for your ultrasound, and it is for a fetal heart. And we have 2 of those in case you have twin gestations, okay? So I like to see the baby's position by doing Leopold maneuvers. That's not needed for checkoffs, but you would just feel to see where your baby's butt is located and where the baby's little parts are located. And our baby here is head down, which is good news. And the best place to monitor is on the baby's back. And I think this baby's back is over in this area. So you want to just put not too much gel. I put this on medium volume. We're going to find our little baby model. Okay, so when you first hear fetal heart tones, I always like to, but you can put, you want to compare to make sure it's not the pulse of the mother. Placenta. So you want to feel in her pulse, baby's heart rate is 140s and hers is about 60. So now you know you're on the fetal heart tones. Okay. And a way to do that without having to actually do a radial pulse is if you already have her hooked up to the monitor, go ahead and put her on a O2 sat machine and you can do it that way. I'll turn this down. Okay, and again the TOCO, this is our pressure side. This does not go against the patient. This is the pressure side. Go to your fundus. Feel hers is right there. Your baby's dropping a little bit. Just a little bit. You feel it? Okay, so your TOCO is going to read a high pressure. You want to zero it. Right here's the auto zero, and it keeps it at about 10. So push that button. And see my preset is at 10. So once it's at 10, it will record uterine contractions here and fetal heart tones here. Okay. So right on this sheet, this down here will be your contractions or your TOCO, and this will be our fetal heart tones. Fetal heart tones you want 120 to 160, and you want to see accelerations with movements. You don't want to see decelerations. And with your TOCO, you want to see any uterine irritability or any contractions. So we're going to watch her. Okay, another thing, before I do Leopold's, I usually have the patient urinate. That's a good time to get your urine sample and run it to lab. Get them comfortable before you do your Leopold maneuvers and also before you put them on the monitor. Okay. I needed to start, and I did not, by explaining the procedure to the patient. And I took it for granted because it is Hannah. So yeah, your first thing you're going to do is explain the procedure to the patient. This first checkoff is for fetal heart monitoring only, and we're going to go over it again real quick. You're going to come in, get familiar with your machine prior to, gather your material, explain the procedure to the patient, put a fetal band, or you can use the belts. You're going to get your ultrasound out, which has the blue end, and you're going to put the gel on that, ultrasound gel. You're going to find your fetal heart tones, compare it to your radial pulse to make sure you're getting baby. You want baby between 120 and 160. Then you're going to feel the top of the fundus, put your TOCO on, and we have good, the TOCO's in a good position there, and then zero your machine. And then that will allow me time to monitor her. This is to be used when you're monitoring patient for possible active labor, early labor, or also if you just want to check baby's fetal heart tones and baby's well-being. Okay, so that is completing the check off for fetal heart monitor. You also, for documentation, I like to write my patient's name on here, or you can use your sticker, patient's name, E-number, all that, and then I always like to date and time it. And then when you're done, we will be taking these and you'll put them with your ER record, or if the patient's inpatient for any reason, you put it in there. They're going to scan it and keep it. So this is part of the medical record, and we must keep up with that. Okay? Okay, that ends your fetal heart monitor checkup.